Remember that there are different stages of gout: the acute gout, chronic gout, and finally, the development of urate stones is another complication that can also occur. When you have gout, urate crystals can build up in your joints for years without you knowing that they are there. When there are a lot of crystals in your joints, some of them can spill out from the cartilage into the space between the two bones in a joint. These tiny, hard, sharp crystals can rub against the soft lining of the joint, which is called as the synovium. It causes a lot of pain, swelling, and inflammation. When this happens, it's known as an acute attack, or also termed as the flare of gout. During an acute attack of gout, the affected joints becomes very painful, tender, red, hot, and swollen. The skin over the joint often appears shiny and may peel off a little as the attack settles. Attacks usually come on very quickly, often during the night. Doctors describe the sudden development of symptoms as acute. The attack usually settles after about 5 to 7 days, but it can go on for longer. If gout is left untreated, attacks can become more common and may spread to new joints. Attacks typically affect the joint at the base of the big toe and often starts in the early hours of the morning. This condition is also known as podagra. The symptoms develop quickly and are at their worst within just 12 to 24 hours of first noticing that anything is wrong. Any light contact with the affected joint is very painful. Even the weight of a bed sheet or wearing a socks can be unbearable. Although gout most often affects the big toe, other joints may also be affected, including your ankles, knees, elbows, wrists, and fingers. It's possible for several joints to be affected at the same time. It's not common to have gout in joints towards the center of your body, such as the spine, shoulders, or hips. Gout attacks are especially common in joints at the end of your legs and arms, such as in your fingers and toes. This is probably because these parts of the body are cooler and low temperature make it more likely for the crystals to form there. Similar attacks can be caused by a condition called acute calcium pyrophosphate crystal arthritis. This is also known as acute CPP crystal arthritis, termed as pseudogout. We'll be discussing that as a separate subject in a different video. Chronic, poly, or oligoarticular gout can cause inflammatory arthritis in older people, especially those on diuretics. No diagnostic pattern exists, although lower limb joint involvement is more common in these cases. Crystal deposits, or which are also termed as tophi, can develop around hands, feet, elbow, and ears. They are particularly common in older women with secondary diuretic-induced gout, in whom they may develop without a history of acute gout. Now, what are tophi? Urate crystals can also collect outside of the joints and can be seen under the skin, forming small firm lumps which are called as tophi. Tophi are chalky deposits of urate embedded in a matrix of lipid, proteins, and calcific debris. You can sometimes see the whitey color of the urate crystals under the skin. The most common areas for tophi are over the top of the toes, back of the heel, front of the knee, back of the fingers and wrists, around the elbow, and it can be even the ears. Tophi aren't usually painful, but they can get in the way of a normal daily activities. They can sometimes become inflamed, break down, and leak pus-like fluid with gritty white material. These are the urate crystals. Tophi can also grow within your joints and cause damage to your cartilage and bone. This can lead to more regular daily pain when you use the affected joint. Tophi can contribute to a destructive arthropathy and secondary osteoarthritis. This image will help you remember the clinical features of hyperuricemia and gout, which include the gouty tophi on the pinna. Then we can have the olecranon bursitis in these patients, the gouty tophi on the hands. It can also include the kidneys and develop the gouty nephropathies with or without the development of stones. Then we have the involvement of the large joints, which is going to result in oligoarthritis. And then we have the development of the inflammation in the first metacarpal joint, which is known as or termed as podagra in the patients. 1 in 5 patients with gout overexcrete urate and may develop urate stones. Around 5% of the renal stones are pure urate. However, urinary urate may co-participate in calcium oxalate or phosphate stones. Serum urate should be mired in patients with a history of renal colic. Uricose-uric drugs should be avoided in patients with a history of urate-containing renal stones. Patients with ileostomies are prone to the development of urate stones as a consequence of producing concentrated acidic urine. Now we'll be moving on to the differential diagnosis in these particular patients of gout.